Hi, everybody.
Hi.
Welcome to another exciting edition of Living at Your Highest Quality of Life with the doctors at Inspire Wellness. I'm Dr. Dan Neides, and this is Dr.
Jessica Hutchins.
So thank you so much for being here today. I want to remind you of a couple things. One is that we have a lot of content at our website, which is www.inspirewellnessmd, like medicaldoctor.com. So please go there if you're looking for more information. And we just want to say how much we appreciate you joining us today. And our topic is irritable bowel syndrome, or the truth about irritable bowel syndrome. So very excited to have you here. And again, thank you so much for your suggestions on topics. Keep them coming in, and we will keep rolling those out. We want to remind you that next Tuesday's topic is going to be on what?
On non-celiac gluten sensitivity and tips on how to start a gluten-free diet for kids maybe on the spectrum or people who know they have sensitivity, and even people who have just been diagnosed with celiac, just how to avoid gluten when you're shopping and living.
Well, I'm personally excited about that because I had very high antibodies against all things gluten in my food sensitivity panel. So I really want to hear what you have to say about how to live with non-celiac gluten sensitivity. So that will be next week. I also want to remind you that with the warmer weather here in Northeast Ohio, we have farmers markets
like the Shaker one for sure on this side.
So on the east side of town, definitely the Shaker farmers market. Legacy Village, I believe, has one. And for you West Siders, I would check online. But Northeast Ohio has so many opportunities for farmers markets. And so this is a great opportunity over the summer with just an abundance of this real food that local farmers are growing. Here's a great opportunity for us to remove the processed foods from the diet and really try to make the necessary dietary changes that will allow us to thrive. So please, I would say make a commitment to yourself. Give up processed food for a day or two and see how you feel and let that build upon itself. But remember the farmers markets. So let's jump in now and talk about irritable bowel syndrome, the truth about irritable bowel syndrome. So I want to first start by recognizing, for those of you who are suffering with that diagnosis, I know how troubling that can be. Always wanting to recognize where the nearest bathroom is, having to be incredibly careful about what you eat, and oftentimes you're prescribed medications that have some pretty nasty side effects. When people are diagnosed with irritable bowel syndrome, one of the treatments is to try to reduce spasming associated with that condition. And many of the medicines that we use to stop that spasming are called anticholinergic drugs. And some of the side effects can be things like dry mouth and dry eyes, lightheadedness, dizziness. I mean, they just have a tremendous side effect profile that is oftentimes intolerable to our patients. So we really feel badly for those who are suffering from this diagnosis, and we're here to bust myths as well as give you some key takeaways on this diagnosis. So the first thing that I want to discuss, or the first myth that we want to discuss, is that IBS, or irritable bowel syndrome, is a diagnosis of exclusion, and that it is something that is only caused by stress. So do you want to tackle that one? Do you want me to tackle that?
Yeah, sure. So the diagnosis of exclusion, basically if you go to a GI doctor or a primary care doctor, they'll run a bunch of tests, maybe scope you and look inside, and when nothing comes back showing an abnormal result, they'll say, oh, you just have IBS. So it's not that they find something specific to make that diagnosis. They usually are finding nothing that leads to that diagnosis, which in my mind, how can you adequately treat it when you're not sure at all of what the root causes might be? So that's myth number one, that it is not a diagnosis of exclusion. There's actually something causing it. And I know we were talking about this earlier, that you think IBS is one of the most laughable diagnoses out there almost. I mean, it's sort of just made up.
Well, actually, that's not what I said, and I will keep my mouth clean for the purposes of Facebook Live. I said it's one of the biggest BS diagnoses, and that's coming from the lens of a primary care physician. I would send patients to gastroenterology, and like you said, when testing would come back fine, they would be given this prescription. But realistically, it becomes this catch-all basin when we can't find anything wrong with the individual. We say, well, you just have irritable bowel, take this and go on your merry way. And oftentimes the medication isn't even satisfactory in terms of treatment itself.
Right.
And so that's really why I said that.
Sorry.
So.
And so when you're told, here, take a medication or go see a GI doctor, you're often also told, well, you might want to go see a psychiatrist too if all the tests and the workup are negative. And a lot of people think that it is stress. And there's no question at all that stress is a contributor, and it can be a major contributor in some people to any kind of chronic symptoms. It's not that stress isn't important. Stress affects specifically your immune system that runs in your gut and helps protect against the different organisms and parasite overgrowth, etc. So stress definitely has a part in it in some people, but you have to look for more than that. You can't just assume that it's stress and some Prozac will make the IBS symptoms go away, because you're still not getting to the root cause. So those are probably the biggest myths about IBS. So it's a collection of symptoms that somebody felt like they had to put a name on, probably in order to just generate a bill for the insurance. But now that everybody knows that it's not a real diagnosis, let's get to the root cause. So I wanted to start off with a case real quick, just to summarize how we as functional medicine doctors try to go about trying to find the root cause. So I saw someone who was in her 60s, and she came to me. She was just diagnosed with osteoporosis. She was worried about that, and it turns out she had significant brain fog, fatigue, a little bit of weight gain. Her belly looked pregnant. I'm sure all of you guys have seen or heard about food babies. You eat, and the volume of what you eat definitely doesn't match the volume that your stomach just pooped out from eating, from gas, etc. What else? Oh, she had bad rosacea too, which is an inflammatory condition of the skin right around the nose and the cheeks. And so during our workup, we looked at food sensitivities. We looked at bacterial overgrowth, yeast overgrowth, specifically SIBO, which is small intestinal bacterial overgrowth. And that's hard to diagnose with just going to a GI doctor and doing a scope, because it's in the small bowel, which isn't very well visualized, and biopsies aren't often done except at the very top part of the small bowel. So the test we did was called a breath test, and they looked for hydrogen and methane producing gases from these bacteria, and she had a lot of both, and she had extra methane producing bacteria, and that tends to lead more to constipation, which she had a major problem with as well. So we treated her small intestinal bacterial overgrowth, or SIBO, but interestingly enough, we also discovered that she was positive and had a very high risk of celiac disease based on genetic testing. And we knew that gluten might be a problem just based on food sensitivity testing, but when somebody shows up positive for the celiac gene, that's a whole different ballgame. I mean, there's pretty much no way you're going to acquire celiac disease if you don't expose your immune system to gluten. So we took her off gluten 100%, and she was very, very compliant, and the symptoms just really miraculously went away with the SIBO treatment and staying off gluten. So gluten, honestly, if you had to do one thing and you had IBS and you just weren't ready to come to a doctor right now, I would say just stop gluten 100% and see what happens. There are a small percent of patients whose IBS symptoms truly are solely related to gluten. Most of them, it's a combination of things, but it's something easy to try at home. And so basically, just leaping off of that, let's talk about our 5R program a little bit, and the gut healing, and just how functional medicine goes about that.
Well, wanted to remind people that as we get into the 5R, that comes from the world of functional medicine. We'll get to what that stands for. But let's make sure that we're interweaving the things that drive chronic disease, which would be inflammation, deficiencies of vitamins and minerals, and an inability to detoxify out what the body doesn't need to hold on to. So it's really important that regardless of the lens that we're looking through in terms of the disease state or the symptom that the patient is presenting with, that lens is always incorporating, for us as the functional medicine providers, it is always incorporating inflammation, deficiencies, and an inability to detoxify. So let's talk about the 5Rs through the perspective of those three concepts, Doctor.
Right. So they're remove, replace, reinoculate, repair, and rebalance. And the rebalance one was just added somewhat recently. So remove, that's where a lot of testing comes in. We want to remove the bad bugs, whether it's parasite overgrowth, candida overgrowth, which is really common we see these days with a lot of antibiotic use and high sugar diets, the small intestinal bacterial overgrowth, or there can be a few bad bacteria like Klebsiella overgrowth, et cetera, that can cause inflammation in the gut. So those things are addressing the inflammatory component. And it's also really important in the remove phase to figure out what foods are triggers for you. And we do that either with an elimination diet, where you take out the most common inflammatory foods for 30 days, 100%, and then you reintroduce one at a time, and you really notice more than when you're just eating them every day what ones affect you or not. And we also do a lot of IgG food sensitivity testing as well. So that's how you figure out what to remove. And then you've got to figure out what to replace. And a lot of times our digestive enzymes aren't working as well when there's inflammation in the gut. So we can do testing for that as well. We can just make assumptions based on clinical history, but oftentimes short-term digestive enzyme supplementation or stomach acid supplementation or even bile, especially for people who have had their gallbladder removed. So that bile is often important for detoxification too, and digestion.
And I also think that sometimes we forget the importance of hydrochloric acid. Hydrochloric acid is produced in the stomach, and it has benefits in multiple ways, one of which is to help protect the microbiome from organisms so the acid itself can neutralize them. But hydrochloric acid also helps to break food down. So I think there's also instances where people are under producing hydrochloric acid, and it can cause
probably a lot more
problems.
Underproduction than overproduction, honestly. A little too much Nexium prescribed, maybe not for the right reasons.
Correct.
So the third one is reinoculate, and that's getting all the good bugs back in there and the good yeasts. And we can't forget that eating fermented foods is one of the best ways. Eating probiotic-rich foods helps keep the good bacteria there. So that's important.
So things like kimchi,
sauerkraut,
pickles.
Sure, any fermented
kefir.
Vegetable, and they're really easy to make. I think we talked about this before. Google how to make fermented vegetables. You can have a couple jars going all at once on your counter. And they're great. You can just add a couple teaspoons or tablespoons to any dinner or even any breakfast with some eggs. So there's a lot of ways to reinoculate. And sometimes you need a short-term supplement. Sometimes it's hard to, if you have to kill a bunch of the other more detrimental things like yeast and bad bacteria, you might need a short-term supplement of a really high dose of probiotics just in the interim until you can keep them there and feed them and have them create a home there in your gut.
Nice.
So the next one is repair. So because of the inflammation in the lining of the gut, often the cells need energy and substrate substances to repair themselves. And glutamine is one of the primary energy sources for these cells that line the gut. Glutamine you can find in a lot of supplements, just plain glutamine powder. We like to use a couple different combinations of powders with glutamine. One is called GI Revive. Designs for Health makes that. Another one we use all the time is GlutaShield from Orthomolecular. But they have things like slippery elm, aloe, zinc, carnosine, vitamin A, DGL, licorice. So a lot of really good healing nutrients for the gut lining. You need to make sure you have enough vitamin D as well. That's really important. And then fish oil or omega-3 fatty acids as well. And vitamin A and zinc, which is, again, in those other supplements. So all of those things you need to provide for your cells in the gut for them to heal.
Great. So we definitely talked about the role of inflammation and then these important nutrients from, again, a deficiency standpoint that may help repair. How about detoxification? Where does that fall into your 5R?
Well, the rebalance part does involve detoxification as well, because one of the first things is sleep. And sleep during when you sleep, that's a really good time to repair your body and detoxify. That's probably when the most detoxification happens, when you sleep. As well as stress, limiting your stress is part of the 5th R rebalance. So stress, we know, is probably our number one toxin. So getting rid of that, or at least decreasing how it affects your body physiologically, will help. And also with toxins, when you have gut inflammation, the toxins from the bacteria and yeast, especially something called lipopolysaccharide or LPS, can leak through into the bloodstream and cause a significant amount of problems. So again, detoxifying in any way you can, whether it's making sure you're pooping well, urinating well, drinking enough water, getting in the infrared sauna to help detoxify some of these bacterial products.
Epsom salt baths.
Oh, sure. Yeah. Epsom salt baths are a great form of detoxification, and they're super relaxing too.
Oh, and speaking of the farmers markets, how about our cruciferous vegetables?
Oh, right. Sure. Anything with, sulforaphane. So Brussels sprouts, broccoli, cauliflower, cabbage, all of those are really good detoxifiers. Cilantro and parsley have really good detoxification properties.
Outstanding.
So yeah, all of that together. And it's not the kind of thing where you want to just pick the first R and work on that, and then the second, and then 6 months later get to the third. I mean, you want to do as much as you can all at once together, especially the rebalance part and the repair part, to give your body enough nutrients that it needs. So, someone just wrote that they're eating kimchi right now. All right.
Outstanding. Hopefully you are learning how to make it so that you can have it homemade and available at any time. So that was a really great review. Kind of want to remind people about the practice at Inspire Wellness, who's a good fit with us, who's not. So, I mean, ideally, we're looking for patients who are highly motivated with all things lifestyle, really interested in learning about optimal nutrition for their bodies, how to manage stress through mindfulness, certainly exercise and good sleep hygiene, loving kindness. These are key core concepts for us and how we teach and try to motivate ourselves and our patients to living a higher quality of life. So, that's really for people who are interested in functional medicine and interested in working with us. We'd really like to have that as a baseline for people who are really motivated to do the heavy lifting that's required to live at a higher quality of life. So we recognize that we're up against it. Look forward to seeing you next week when we talk about non-celiac gluten sensitivity, and want to thank Dr. Hutchins for the case study and that wonderful review. Remember, it's your time to thrive. Let us inspire you. Have a great rest of the week. Look forward to seeing you next week.
Bye.
Bye, everyone.